Good evening, I'm Casey Nolan. Welcome to Stay Tuned. Tonight's topic couldn't be more timely. It's getting all the headlines. It's causing headaches. Some love it, some hate it, some are left out of it. So let's talk about it. The Affordable Care Act, or Obamacare.
One main goal of the Affordable Care Act is to make sure that every American has health insurance. The new health care law aims to eliminate barriers like job status, income, and medical history that have often left Americans uninsured or underinsured. Under this legislation, everyone is required to be insured by 2014 or face a penalty. One way to enroll is through the insurance marketplace, also called the exchange, a place to shop and compare subsidized insurance plans. But a lot of people still have a lot of questions. Am I eligible? What if I already have coverage? Is the marketplace for me? Tonight, we hope to have some answers. So stay tuned.
Okay, welcome back into the studio and welcome back to the show. Tim McBride from Washington University, health policy analyst. I think, Tim, you've done a great job in the past of kind of giving us a baseline starting point for these conversations. We'd like to do that again tonight. So first, before we get going too far down this road, the marketplace. Help us understand what it is. We used to call it the exchange, but just real quick, the marketplace is what and how important to the ACA?
Well, it's important. It's not the entire bill, but the marketplace is where many people who are uninsured would be signing up for health insurance. Think of it as an online portal like Expedia or Travelocity, or a place where people can go buy these private insurance plans if they're uninsured.
The difference being, Expedia usually works.
That's right. I mean, unfortunately, it's not a funny thing. The rollout has not been very smooth, unfortunately, at least for the healthcare.gov part of it. And I think one important distinction I would make is the healthcare.gov is what's governing about half the states. And about a half the states are going with their own state exchanges. In Missouri here, we're using healthcare.gov. And it's not been very smooth, as most people know.
We didn't set up our own, therefore we default to the federal level.
Right.
Okay, so get us up to speed on that. We can't talk about this issue without talking about current events. Where do we stand now? Things are changing literally every day this week.
Literally every moment. I expect they're trying to fix the code on it. I don't think there's any way to put it, but it didn't roll out very well with the website. I don't think it's a very good website, but they're fixing it fast, hopefully. And it wasn't able to take the amount of traffic they're getting. It's very cumbersome, and it's not been very easy for people to use it. They say that by the end of November they'll have it fixed, at least for healthcare.gov, and we'll see. That probably won't be too late to make this work because people can sign up for 6 months. But if it goes much past that, we might start having some problems.
It's not the only way to sign up, though, is that correct?
No, people can sign up by calling an 800 number, which will be accessible by the website or other places. You could also sign up on paper, and there are navigators in most states.
We've also seen some people with a little bit of sticker shock once they've gotten in there. Can you talk about that at all? It's more expensive than they expected it to be.
It really kind of depends on what your situation is. Again, some of the people who had individual coverage, which was pretty cheap before, that might have been pretty limited, their plans are going to be going up in price. Other people, the prices are pretty reasonable, perhaps. And I think you have to look at all parts of the bill because you have to go through to figure out what your subsidy is going to be before you really know what the prices are. But especially in some states, the prices can be pretty high. And it varies by age.
And another headline that we should mention too is that some folks had their policies canceled.
Right, and I think this was a sort of under the radar thing. I think most of us who were following this knew that this was going to happen, that there were plans that were so-called not grandfathered plans, is the way to put it, that weren't going to meet the standards under the Affordable Care Act, and then they're now getting letters saying your plan's canceled and you got to go into the exchange. And those bills, those plans might be more expensive for people.
And so that's a lot of different moving parts for a lot of different people, but also a lot of people need to do nothing?
Well, if you have employer-sponsored insurance coverage, if you have Medicare, of course, you probably don't have to do anything. So, that's the vast bulk of people. Like, for example, this individual coverage issue we just talked about, that's probably about 5% of the population, so it's a fairly small piece of the population. But that's still millions of people.
People who buy their own, who are buying their own insurance. Talk about the math behind this. How important is it that they get a lot of people? The goal is to get everyone covered.
Yeah, the goal was to get about 7 million people in the exchanges in the long run. I don't know at this point whether that'll be achieved. And the goal was to get young people in there as well as older people, healthy people as well as sick people. One thing I would point out is, for example, in Massachusetts, when this rolled out at the end of the first month, there were only about 120 people signed up. But at the end of the 6-month period, they had 36,000. So that we could see something like that. And the same thing happened with Medicare Part D, that at the end of the first month, there were 1 million people, and at the end of 6 months, there were 12 million people. So many of us expect that this will grow over time. And it's complicated, and it's difficult, and we know with the website, it's not making it any easier.
And so we have some work to do tonight.
Oh, absolutely.
And some
this
questions
is very helpful for people, I think.
Let's hope so. Thanks for starting us off right. Tim McBride, thank you very much from Washington University. And we need your help tonight as well. Ed Reggie is here to tell us how that happens. Ed?
Thanks, Casey. Well, we're hearing a lot about the health insurance marketplace on the news and across social media. And we'd like to know what you need to know to understand the information. So there's a couple ways you can do that, actually. We have put a question up on our Facebook page, The 9 Network. We want you to log on to The 9 Network and share your insights, your comments. Tell us what we're missing in tonight's conversation. You can also use Twitter using the hashtag StayTunedSTL. Tweet us your questions and we'll be bringing them throughout the entire broadcast. Let's see what you already say.
Okay, let me do some introductions first for our first table. Joining us again, welcome back to all of you, all repeat guests on the show here. Bill Hill, insurance broker, thanks for being here with us. Jen Bursdale, Missouri Healthcare for All, thank you, Jen. And Doug Poe, doctor, and with Barnes-Jewish as well, BJC Health Systems. Okay, so before we try to answer questions about the marketplace, we wanted to meet someone who is doing just that, shopping on the marketplace. We did not have to go too far to find him. The 9 Network's Anne Marie Berger introduces us to just such an individual.
My name's Seth Donnelly, I'm 25, and I'm a freelance videographer, TV production.
Seth works on a freelance basis for various television productions, including a few at the 9 Network, but his main gig is working as a drummer.
Yeah, I started playing drums in high school, and always just for fun. Played in bands here and there, and never making money or anything. Then I got in Dance Floor Riot and realized that I could actually make a decent living playing drums. We've been together for like 4.5 years. I put a lot of money and effort into drums. I mean, I don't have a weekend life anymore. I play shows every weekend. And people think that, oh, you're playing drums, you're having fun, you're playing. And it is fun sometimes, but I mean, it's a job. It's every weekend, every Friday, Saturday, I'm working from 5 p.m. till 2 in the morning, playing drums, getting loaded up, loaded out every weekend. I've been working at this really hard for a long time, and finally started to get there.
Like many self-employed Americans, Seth does not have health insurance.
And why is that?
I can't afford it. I'm in a position where I don't, my two jobs, being a musician and a freelancer, I don't have benefits. I don't have people offering me anything.
While not having health insurance hasn't been an issue, Seth's a pretty healthy guy with the exception of the occasional cold, he does have his concerns.
I have family that have been in accidents and not had health insurance and are going to be forever in debt. So there's always that fear of if I get in a really bad accident or something like that, I'm not covered.
So Seth is going shopping at the health insurance marketplace in hopes there is some kind of plan he can afford. Available to those under the age of 30 or those who meet the financial hardship exemption is the catastrophic plan. It's a safety net. If he's in an accident or blows out a knee, he'd be covered. This plan offers the lowest premiums with the highest deductible. As the plans improve, premiums increase and out-of-pocket costs decrease. The Bronze plan covers 60% of all healthcare costs. The Silver plan, 70%. Moving up to Gold, you'll find the highest monthly premiums, but lowest out-of-pocket costs with 80% covered. There's also a Platinum plan, but that's not available in Missouri at this time. So here's the deal. All plans must meet a minimum standard of coverage, and there's a few big changes. You can't be denied because you have a pre-existing health condition, and you won't be charged more because you're a woman. However, you will be charged more if you're a smoker. So if Seth does buy insurance through the marketplace, he's not buying insurance from the government, rather private insurance companies, and he'll receive a bill from them just like he does his cell phone provider.
I kept trying to log on. I would get to pretty much the same point every time, and it would just freeze up.
A week after Seth tried shopping on the online marketplace and failed, he decided to go at it from a different route.
I just got to work and getting ready to start my shift, and so I'm going to call this 1-800 number and try to get some health care.
Welcome to the Health Insurance Marketplace Call Center. How can I help you?
I'm calling about getting some health insurance.
And what state are you calling from?
Missouri?
To set up an account in the marketplace and determine what, if any, discounts an applicant is eligible for, one must provide a social security number or document numbers for legal immigrants, employer and income information, policy numbers for any current health insurance plans, and if applicable, a completed employer coverage tool, a document that can be downloaded at healthcare.gov. Seth spent about 20 minutes on the phone with an operator submitting his application. Once it's processed, he'll receive an email explaining his health insurance options. And for Seth, just getting the ball rolling is a step in the right direction.
Thank you for calling the marketplace, and you have a good rest of the day.
All right, Seth, so it's been a week or so since you called the health insurance marketplace on the phone. Where are you in the process of getting health insurance?
The same place I have been. Nothing's developed. I haven't gotten any information.
So you haven't been contacted, hey, your application is processing, nothing?
Mm-mm.
You still want health insurance, so how's this waiting game?
It's a bummer. I don't know. I didn't think I'd be able to afford it in my 20s at all. And now that it's right there, I'm anxious to figure out if I'm going to actually be able to afford it. Yes, sir.
Seth is one in about 800,000 uninsured Missourians, many of whom share the same frustrations about the marketplace. So Seth gave the calculator found on the Kaiser Family Foundation website a try. So go ahead and plug in your stuff.
Is that it?
Mm-hmm. So down here it gives you your results.
Okay. It comes out to like $96 a month, which is way more affordable than I thought it would be. I was expecting at least a couple $100.
You're not going to be able to sign up for it until the kinks get worked out on the website. After we're done talking here,
are you actually going to follow up with this?
Now that I know it's a realistic thing, I'm definitely going to get it. Yeah.
That's Seth you're looking at right there. Seth, thanks for sharing your story. We would invite you to the table to sit with us and talk more about this, but if you take that headset off, we will not know where to go and when to do it. But in all seriousness, thank you for sharing your story with us. What you just saw there, that was an excerpt from Open for Business, Nine's special report on health insurance marketplace. To see more, you can visit ninenet.org/health. Okay, so let's go back to the table and let's just pick up right there with Seth. Seth is what we might call the young invincible, I think. Mm-hmm. How important is Seth to the success of this healthcare law?
I think it's most important is that the healthcare law is important to Seth. And I think the video actually sums up pretty well here. Someone who's certainly been affected by the fact that the website has some challenges, but he's motivated, he's excited, what he knows of what's there is encouraging. And I think what's really important is for folks to be patient, to go back, to try again. Things are getting better, people are starting to enroll, and I think it's important that people who haven't been able to get affordable health insurance are having options and are going to have options moving forward.
But the law does need Seth and people like him. Out of the 7 million people they're hoping to sign up, they need at least 3 to 4 million of them to be people like Seth, who otherwise are fairly healthy. They're unlikely to need a lot of healthcare services. He might take advantage of the physicals and other things, preventive that are covered there. But otherwise, he's not going to cost the system a lot of money. They need that so that folks that really do have a lot of healthcare problems and need a lot of health services, those folks can be covered and not pay too much.
But nobody's really talking about the expense of this, and that's really where it boils down to, Doctor. And that Seth may only have to pay $90-something for his coverage and a monthly premium after the subsidy, and that's if the subsidies continue to flow. I'm sure we could talk to some doctors over in Illinois about the subsidies that they're supposed to get from the state. But with that, there is out of pocket that is probably $6,350. And my question to Seth would be, can you afford not only the $93, but all the out-of-pocket expenses that you're going to face for that plan that costs $93?
Yeah, I'm finding that with talking to my patients as well. There's we need to go back to an old adage. There's no such thing as a free lunch. Someone has to pay for it. And so if we're going to make this program work, we need to really do the math carefully. And there's just been not that much speech in the public sector that has either been overly rosy or harshly critical. We need really informative speech. And so as I talk to my patients, I ask them the same thing. Have you really looked at all of the parameters? For instance, am I on the plan? Not all doctors or hospitals are going to accept all of these plans. Can you really keep your doctor? Have you thought about the deductibles? Do you know what services you need as a person? And then look at the plan carefully to make sure that plan actually covers those. Or if it doesn't, are you okay with that? Are you okay with the expense that will mean for you?
So the president used the cell phone plan analogy. Do we know what we're getting? Is this getting clearer for people? You guys are all on the front lines and talking to people. Are they able to make these kind of choices like you do when you buy a cell phone plan?
No. There's too much information that has to be disseminated by an individual who is not usually used to making insurance decisions. Right now we have a system that is mostly run and guided by the employers. And one person in the employer is making the decision for how many employees work and their dependents. So employees have pretty much been shielded from that whole accountability and responsibility. So consequently, they know very little about the insurance.
They've been given their cell phones at work and they don't even pay the bill.
That is correct. So,
or they pay 3/4 of the bill.
And to make matters worse, these the plans that were in force in 2013 were somewhat understandable. Everybody's had some exposure to them on the employer side. But now they are adding so many different variations to the plans just to get to those metallic levels that are being forced upon them by the law. So you're going to see things like deductibles, separate deductibles for medical and for drugs. Well, that's very rarely do you run across that now. So that's going to be a new world for the employee to have to figure out.
So go ahead. I was going to say let's help these folks who have to buy their own cell phone. Go ahead.
Right. It is new information and people are learning it. Actually, when I bought my first cell phone plan, it was totally confusing to me. And my experience as we do education out in the community is that people really do benefit from having a person live, right there in front of them, explaining it to them, whether it's one-on-one or even in a small group. Folks seem to get it more when someone actually explains it than when they read it. So I think it is new information. People are having to learn a lot. I also think people are smart. I think we can learn these things, and I think we will learn them. And we look to Massachusetts, where I talked to someone who works there who says, 5-6 years down the road, people by and large get this. They get how it works. They understand what they're supposed to look for. And I think it is incumbent on everyone in the community to help folks learn what they need to learn as they make this first step.
But Jen, if they make a mistake, just like in Massachusetts, which everybody for some reason brings up, but if they make a mistake when they're trying to acquire their coverage, they will not have coverage for the first year. They will not be able to get it because they didn't apply in a timely manner, or they didn't fill out the paperwork correctly, or something. And the people who we're relying on to deliver the services, these navigators, they do not have the experience necessary to understand an insurance contract. They're not even supposed to explain it, but how are they going to do with 4 weeks of training what's taken someone in my role years to understand, and it's always changing?
We have about 30 seconds. You talked about that middle ground of speech. What would you tell people in that middle ground to help answer some questions that they have? What are the number one questions? What is the number one question you're getting?
Number one question I get is can I still get health care where I normally do if I go on one of these plans? That is, and what I tell everybody right away is, it's not a trick when you finally get a chance to either get through the website or through a separate company website, and you can look at that plan directly. Do the due diligence. Look at all the things that pertain to you as an individual. Do they cover the drugs that you take? Do they cover the hospital? Does the hospital that you go to, do they take it? Does your doctor take it? Have you really mapped out how much money it will cost you if you have a normal year where you see your doctor the same number of times? If you go to the emergency room, do you understand what that's going to cost? It's not a trick. There's nothing hidden in the law per se in that sense, but it is complicated. And so people need to walk through it carefully, ask all those questions, take their time. Don't simply just sign up for something willy-nilly on a weekend because you had a moment. It's a big decision, so plan carefully.
Reminds me of my first cell phone package. Okay, let's go for a little bit different perspective. Outside of the St. Louis region, the 9 networks, Jim Kircher traveled to Union, Missouri for that perspective.
Kreider Health Center serves a lot of the working poor and uninsured in suburbs and rural areas in 4 counties. In the Union, Missouri Center, we met up with Wendy Schrader.
So your job is to sign people up?
Correct.
Have you done it yet?
I have been unable to enroll anybody at this point in time.
For lack of interest?
Not for lack of interest. People are absolutely ready to sign up. A lot of our medical patients do not have insurance. A majority of them don't.
You said you've had a lot of interest. Have you had a lot of people say, I don't like Obamacare, I want nothing to do with this?
Yes. Very polarizing topic.
Politically polarizing, but frustrating for those who've come in wanting to buy health insurance and for those trained to help them do that. After 3 weeks of website problems and a couple of days after the president promised to fix them, Wendy Schrader was actually starting to make some headway.
Looks good right now. I actually was just kind of signing on to see if I could, and this is exactly where you want to be able to get to on healthcare.gov.
This is further than you might have gotten a couple weeks ago, yeah?
Oh, absolutely.
Now, we didn't know if this was because the website was being fixed or because fewer people were trying to get online or because she was just lucky. But she was finally finding what every online shopper is looking for.
Well, no, I'm copying and pasting screenshots of the plan prices because I want to be able to tell people, some of the deductibles and premiums and things. I'm actually able to get in there right now, so it's pretty exciting.
Schrader already knows there is a demand for affordable health coverage in this community. She also knows that some low-income people are going to be turned away because under the Affordable Care Act, they actually make too little to buy on the marketplace. They were supposed to be covered by Medicaid expansion, but that didn't happen in Missouri. And those people fall into a health insurance no man's land called the coverage gap.
Welcome back to 2 more of our guests, and welcome for the first time to another. We'll start with Yvonne Bullinger from Grace Hill. Thank you for coming back. Rob Friend, Regional Health Commission, thank you for coming back, and thank you for being here for the first time. Ms. Erica Neal, let's just jump right in where we just left off in that story, the coverage gap. What is the coverage gap?
Under the Affordable Care Act, people over 100% of poverty are able to go to the marketplace and get subsidies to help them purchase their insurance. Unfortunately, if you're between 0 and 100% of poverty, so if you live in poverty, you're not eligible for any subsidy on the marketplace. You are supposed to be covered by Medicaid. And that program was supposed to take care of your health care needs.
You say supposed to because?
Well, because along the way to the implementation, the Supreme Court got involved and said that the Medicaid expansion part of the Affordable Care Act was optional for states. And so states could take the federal government up on their offer or not, and it's up to the states. And in about half the states, they have expanded Medicaid up to 138% of poverty. There is no coverage gap in those states, and in some states they haven't. Missouri is one of those that has not yet expanded Medicaid. So everyone that lives in poverty in Missouri is still uninsured unless you are pregnant, disabled, a child, have kids that make less than $10 a day, or happen to have a job that pays you wages that put you into poverty, and your employer gives you coverage, and that's rare.
Erica, you know a little something about this gap we're talking about here.
Just a little bit. I, in 2011, experienced what I describe as a perfect storm. I had a cancer diagnosis which led to surgery. At that time, I was fortunate and blessed enough to have a Cadillac health insurance plan. After surgery, I found out that I was going to lose my health insurance in December of that year and also take a pay cut in that year. And so for 2012, that left me without any health insurance, which meant the subsequent tests that I needed to have to monitor if there's any recurrence of the cancer, I was not able to have. I was fortunate enough to have met Rob in 2013 this year and was able to get into Gateway to Better Health, the bridge program between the implementation of ACA.
And we want to talk more about that, but if not for that, let's just play this scenario out a little bit here. When everyone starts signing up for the new health care coverage, the ACA, and then there's Medicaid on the other end, you would have found yourself, and you are right in between those two.
I would not be able to get into the exchange, and I would be without health care. And I wouldn't be able to have the diagnostic test that I'm able to have now.
Is this a familiar story with you at Grace Hill?
Yes, absolutely. Just today we had a patient that was in a similar situation that came to Grace Hill, and he came and we discovered some skin cancer, and that was discovered, and then now he's receiving treatment, and if it wasn't because of the Gateway to Better Health, he wouldn't have access to that. He's currently unemployed, so he has no income. So we see many, many patients. We have about 9,700 patients at Grace Hill currently who participate in the Gateway to Better Health program. So we're very grateful for our patients that we have.
And what is Gateway to Better Health? What is it? And thank goodness we have it. Sounds like all of our problems are fixed.
Well, Gateway to Better Health is a coverage program only available for people who reside in St. Louis City and County, and it's only available for adults 19 to 64 years of age and who are under 100% of poverty. So it's not available to everyone.
And I was being facetious. I shouldn't be. How long do we have Gateway to Health?
And right now it's only approved until the end of next year, December 2014.
And then what? When it comes to that gap between Medicaid and the exchanges?
One of two things. One, a lot of people will go without health care at their community health centers, which they have now. They'll go without prevention. They'll go without getting the tests, as we said. They will present very sick. The irony is when you get very, very sick, you become disabled, and then we'll pay for your care. But we won't pay for the care and the coverage needed to keep you healthy in the first place at our community health centers. We're fortunate we did get this waiver for outpatient care. It doesn't cover the inpatient side. Gateway to Better Health only covers outpatient at our community health centers. It keeps our community health centers in our urban core open because we have so many uninsured here in St. Louis. But if we lose that program and Medicaid's not expanded, you will see 25% of all community health centers in St. Louis, like the one Yvonne works for, will shut down. You'll see 50,000, 70,000 probably additional emergency visits flood our urban core, and you'll see St. Louis on the front page of every national publication in the country is how the whole system kind of collapsed out.
Are we starting to see that already? There was an urgent care in the news this week that closed.
One of our we've already had 1,000 layoffs in the healthcare sector already this year, and that's even before the major cuts begin. The thing about the Affordable Care Act is it was graded out as budget neutral by the nonpartisan Congressional Budget Office, which means you got to pay for it some way. Well, the federal government is taking $4 billion out of Missouri over the next 6 years to help pay for coverage. The replacement funds were supposed to come with Medicaid expansion. And if we don't take Medicaid expansion, we don't get the funds that Grace Hill needs, that BJC needs, that SSM needs to continue healthcare in our urban core and in our rural areas. And you'll see hospital closed, you'll see health centers closed, no kidding, and people will have nowhere to go.
Of course, if Speaker Tim Jones were here from the Missouri legislature, he would say that was the system, Medicaid, that wasn't working very well in the first place, so why do you want to pump more money into it and make a bigger, ill-functioning system?
And the answer would be the choice isn't between current state and pumping more money into the system. The choice is between losing $4 billion to help pay for coverage in other states over the next 6 years, or expanding Medicaid. And it's the negative consequences that we need to avoid. We'd like the doctors at Grace Hill and Family Care and Myrtle Davis and BJC and SSM to be able to do their jobs and take care of our population in our urban core. And without the funds available, they just won't be able to. Again, you mentioned we already saw Connect Care close over the last 30 days, just announced it. We'll continue to see closures of major medical institutions across the state because we just don't have the money to operate them because it's being pulled out for coverage in other states.
Thank you all for your time very much. And Erica, thank you for sharing your story with us. We appreciate that very much. We do want to remind you that the 9 Network is dedicated to helping you understand this very issue we are talking about tonight. So for more information, including resources for navigating the marketplace, again, we've said it before, but it is certainly worth repeating. You can visit 9net.org/health. Let's see more of what you're saying online. Okay, we're back in the studio, but let's don't stay in the studio. Let's get a national perspective via Google Hangout, and then welcome back to the show Lisa Zamofsky, healthcare journalist and author of Healthcare Insurance and You, The Savvy Consumer's Guide. Also works for WebMD and the LA Times. I got to believe, Lisa, you're like a CPA at tax time. My gosh, your area of expertise is making headlines every day of the week. Let's just dive right in with what you are seeing. What questions are you getting from people? What's bubbling up for you?
Well, it's interesting that you bring up CPAs because I feel as though I possibly should have went out and gotten one myself, because interestingly, people who are trying to sign up have a tremendous amount of questions about taxes because, as you know, with subsidies, that's a really big part of it. How much do you earn? What counts as taxable income? Those kinds of things. So that's a big question. And then, of course, a lot of confusion still about who's eligible, who can shop the marketplaces, and definitely a lot of questions related to what you're talking about tonight, which is people in states like Missouri, Texas, Florida, who don't earn a lot of money and are concerned about how they're going to get coverage because they live in a state not expanding Medicaid.
Back up one step. We talked about this before with you. Who is confused? What do you want them to know about who should be shopping on the website when it does work and other things in the marketplace?
Yeah, I think probably the most common question, two questions I get are from people who have Medicare coverage and are asking if they can either buy different kinds of plans, a Medicare supplement plan, or if they should drop their current coverage and shop on the marketplace. And the answer to that is no. If you have Medicare, Medicaid, you're covered through the VA, you're covered. You don't need to do anything. The marketplaces are not for you. And the people with employer coverage want to know either should they be shopping on the marketplace, but more commonly, can they find a better deal on the marketplace? Because many are under the impression that either free or low-cost health insurance is available there. And of course, it is for many millions of Americans. But if you have affordable coverage through work, you're not eligible for those tax credits. And in most cases, probably better off staying with your work-based plan.
Okay, let's go back to the other thing you brought up, which is what we were just talking about at the table, that gap that we have in Missouri. We're not the only ones. What are you seeing around the country? How is that playing out around the country?
Yeah, so I believe there are about 24 states right now that are not eligible, that are not expanding, and so those folks in the gap will not be eligible for Medicaid, and it's a huge problem. Really the law won't help them. I don't know how much worse it will make it for them, except for the fact that perhaps those that rely on many of the community-based clinics and safety net hospitals, I think some of those providers, as some of your speakers already alluded to, will probably be further stretched with the implementation of the law. Those folks have been without great options for coverage. They're usually not offered coverage through an employer. They can't afford to buy coverage on their own, and certainly without the help of subsidies if they fall below poverty, which is less than $12,000 a year. Buying an insurance plan without any financial help for most will be impossible.
We heard it mentioned at the top of the show that states that have their own exchange, their own marketplace, are doing better than those like Missouri who are relying on healthcare.gov and the federal marketplace. Do you buy that analysis?
Yeah, that does seem to be the case. I mean, there are certainly states that are not doing well. There was a big story out, unfortunately, just last week or was it earlier this week about Oregon, which started off really promisingly and really has had a tremendous amount of IT problems. They, to my knowledge, based on the last reports I've seen, have not been successful in signing up even one resident so far, and that's a state-based. Kentucky and Washington State, on the other hand, are doing a stellar job and are some of the real stars in all of this. So healthcare in general is incredibly local. It always has been, and that seems to continue to be the case. But generally speaking, yes, you have a better shot if your state's running a marketplace. Generally, again, Oregon's having some tough times, but it is easier for those folks to sign up than those reliant on the federal system right now.
The other big story lately has been, we've touched on it a little bit already, but that the president said if you could keep your plan, if you liked it, you could keep it, and that has not been the case. Where do you see that storyline going? What's the latest on that?
The latest on that is that there are about 14 million people in this country who buy insurance on their own, and probably about half of those are having to, I mean, the numbers aren't concrete, but there are many millions of people who will have to change plans. Their plan is being canceled, but it's not as though they're being dumped out into the street on their own. They're being offered an alternative. And
which can be more expensive. Some have said more expensive options.
Yeah, that's right. If you qualify for a tax subsidy, it could be a lot less expensive than what you've been paying. But for folks who don't, I am hearing from a lot of consumers complaining that their rates are going up, in some cases quite significantly.
Lisa Zimowski, thanks for your time. We appreciate you, as always, being on the show and bringing us some national perspective. Thank you very much.
Great to be here. Thank you.
All right, let's go back to social media. Okay, let's talk about some resources. We've got a lot of questions on the table. Let's figure out where people can get some answers. We'll do some introductions here. From Central Baptist Church, Reverend Robert Scott. Thank you for being here with us. We appreciate it. Alex Hallen, SALU Law student. You're also doing some outreach and some education in this very topic. Nick Semenkovich, welcome back to the show, to you and Alex as well. WashU MD, PhD candidate, still plugging along?
I have no degrees yet.
Okay, well you're gonna, do you get a badge? Because I want to know when you have.
I think so. I think I probably have one of those.
Okay, very good. Okay, so what are you seeing? What the three of you? What are you seeing going on in the community? Is it working? What are questions people have? How are you helping them answer these questions?
Well, I think that first of all, particularly within the African American context, the church really serves as a nexus of giving out information and helping people to understand some of the issues that they're facing. For me, this is a social justice issue as well as an economic issue. So in that particular vein, I felt somewhat compelled to reach out to an organization, and of course your organization came to the rescue with Jen Bursdale coming to share with my congregation. So I canceled a Bible study to have the Missouri Health Initiative to come in and share with our congregation what's going on. So in that particular vein, the church, particularly the African American church, is playing a vital role. And that's happening not only in the city, but also in the county. Christ the King, Pastor by Tracy Blackman, Reverend Rodney Francis at Washington Tabernacle, and some other churches are doing the same thing that I've done.
Same question to you guys. What are you seeing that's actually helping and working?
I think these are kind of inspiring stories. It's really easy to get depressed now and say the insurance marketplace isn't working, the website's broken, everything's terrible, but you got to remember this is a small component of healthcare reform. You know, getting insurance is a great step and something we need to be doing, but this is a part of a bigger issue of getting preventive care out to people, of making people aware about their health, about saying this is flu season, have you had a flu shot, can you see a doctor, can we treat your high blood pressure? I think these outreach efforts are working, and it's great that people are asking questions about their health and really getting involved in the community.
Yeah, we get a lot of questions, not even just about the Affordable Care Act, but one of the questions I get every time I go, and almost, overwhelmingly, is this affecting my Medicare? And I want to say now that if you have Medicare, you're eligible. This does not affect you in any way. You should enroll for your Medicare just like you've always enrolled. And that seems to be a point of a lot of confusion. And so I'm glad that we get to dispel that tonight for everyone who's listening too.
What other questions are you seeing? Because I hear what you're saying, Nick, but for tonight's conversation, we're talking about the importance of getting people signed up so this system works as it was intended. What are the barriers and how are you fixing that? What are the questions you're having to answer and how are you doing it?
Well, I think that within my congregation, some of the questions I've heard come up is what's the cost? That's very important. When is this going to kick in? How does this impact the current insurance I have, if I have insurance? So those are some of the off-the-cuff questions that come to mind. I think there's some deeper issues that we have to wrestle with, and unfortunately this has become a political hot potato, is dispelling a lot of the myths that are coming along with it. The interesting thing is that people fail to understand that what we, quote, use as a euphemism, Obamacare, is the Affordable Care Act. Sure. So they don't have a problem with the Affordable Care Act, but they have a problem calling it Obamacare because of the president. And that's rather unfortunate when basically it's one and the same. It's like saying, I don't want $500,000, but give me $500,000.
Well, I think one of the other things that I know we've talked about on the show prior to right now is the Medicaid expansion. And when we go out and we have to talk to people and tell them, I'm sorry, you can go into the marketplace, but you're not going to get a subsidy, so you're not going to be able to afford insurance. We wrestle with how to tell people that and where to send them and what to do. And there aren't tons of options for people. So part of what we're doing is working on some advocacy for the Medicaid expansion. And that's one of the exciting things, is telling people how they can get engaged with not only their health insurance, but with the political process. And people are really into that and really excited about it. And that's one of the things we try to do through Missouri Healthcare for All and at some of my colleagues at SLU, and that's really great, but it's a process and it's a fight, and we have to keep working for it.
It'll be confusing for a while, but everything is improving. We talk about the problems with the website, and it was a disastrous launch, but it's gotten much better since then, and people are getting on and successfully signing up for plans. There are kinds of other providers. You mentioned earlier on the show, the Kaiser Family Foundation has a wonderful website where you can go and see what plans are available. Things improve every single day, and I think come a month from now, the website will probably be an afterthought. I think we'll say, oh, it works now. It was such a disaster back then, but now we've solved these issues, and people will be able to sign up for care.
I actually I went on Kaiser today to do the subsidy calculator, and it's really easy. You put in your age, you put in where you live, and it tells you what's your average cost for a silver plan with a subsidy. And I put it in just for an average person, 27 years old, $20,000 income, and for a silver plan, I would have paid that person about $1,000 a year. And so I got some information about that. So everybody can go do that now. They can go to Kaiser and find out what they're going to pay maybe on average.
Every program has its growing pains. This is one of them, but I think it's really going to turn around soon.
Okay, two of you mentioned politics. Reverend, in your congregation, let's go back to what you were saying just a minute ago, is Obamacare a dirty word in your congregation?
No.
And is there, okay, so I think I knew the answer to that before I asked it, but I want to know if there's a downside to that. Is there anything what comes to your mind there?
Well, I think that the downside, if we can call it a downside, is the lack of access. At my church, we're in the process of trying to connect with different brokers who can bring different insurance plans to the table. So besides people going to the website, getting people signed up. Because there are some people who don't have access to the internet. They don't have computers. And so that then becomes a barrier. Particularly young people, they're not using the telephone. Mm-hmm. They either go into the computer, but if they don't have access, we gotta try to help to deal with those barriers. So in that particular vein, I think that it's very important for us to continue to keep going back. It's a repeat. But it's very important also for young people who are healthy and the uninsured to get on board because this is an equal opportunity issue. And of course, we know that at some point you're going to need health care. And anything that's worth having is not going to be easy to get, but this is just the trial by error that we're going through, and eventually we're going to get there.
So it sounds like you're saying there might be a different message for different people.
Yes.
And does that ring true with you guys from what you see in your work?
When we go out and we give talks, we think about who our audience is and maybe what they need to know. If we have an older audience who maybe has some more people who are Medicare eligible, we try to tell them how this is not going to really affect them. There are a few things that do affect them, but not really. But if we're talking to a younger audience or people with kids, we have to think about what those messages look like and what information they need, because not every group needs the same information, and that's really important to understand as well.
I think it's very important to distance it from the politics. I think I see many patients who claim that they hate Obamacare, that it's terrible, but you ask them, well, what part of it's bad, and they will tell you the parts that they've benefited from, and they'll say, well, I have a kid that's living at home, and well, they're 25, and they got to stay on my insurance, and I really like that, but no, I hate Obamacare. It's a terrible policy. And I think there's a danger in really conflating politics with what the legislation actually does.
Reverend, you said it's a social justice issue for you. Are you optimistic about the social justice of healthcare?
Yes, I am. I'm very optimistic because, first of all, because of my faith, and second of all, because of the country in which we live, and with us trying to make this major paradigm shift that's not going to benefit a particular core, but it's going to benefit all. And the sacrifice for those persons who may have to pay a little bit more extra outweighs the cost for those that are paying extra to be a blessing to those who will benefit from this plan.
Reverend, Alex, Nick, thank you all for your time very much. And then again, to make sure we have resources that you can go to, you guys mentioned the website. We're going to get all of that in one location that's easy to find. And that again is 9net.org/health. Let's get back to social media for resources for this show. Okay, let's come back over to this side of the studio to another return guest on the show, Tara Kulash from the St. Louis Post-Dispatch. We established last time this must be a newsworthy topic because you've created a beat just for this issue,
Yep.
and this is your beat. We had you do you played the role of fact checker last time. We'd like to ask you to do that again. So I've got a couple of questions for you, but I see that you've got a couple of things written down on the reporter notepad.
Yes.
What stood out to you tonight?
Okay, well, I think a couple of things is, first, they were talking about how people are getting frustrated that, first of all, you've got all these glitches with the website that are keeping people from getting signed up, but the people that are making it on are putting in the wrong information and it's getting mixed up. Well, I think a key factor with that is a lot of these people that are signing up for healthcare on these websites are not tech savvy. Obama, in his presidential campaign, went for more of a digital kind of feel, used the internet, and that was to target the younger audience, and that worked for a presidential campaign. When we're talking about healthcare, it's a lot harder to sell that to young people because they think they don't need it and they can't afford it. So
They're not passionate about healthcare like they might be politics.
Right. Now the people who are passionate about healthcare are the older and sicker who are either not making as much money and so they don't really have internet access, or they're older and they haven't caught up with internet and they hate it and they don't want to use it. So now they're having to use this platform that they don't really want to use and they can't really figure it out very well. So I mean, navigators are a good thing. They help them out, and I definitely recommend talking with one.
And tell us what a navigator is. That's an individual you're talking about here.
There's different kinds. So a navigator is funded by the federal government, and they are to help people get signed up for insurance online.
And if one finds a navigator, how?
Oh, there's lots of different locations. I could tell you if you go to covermissouri.org or getcoveredillinois.gov, they have navigator locations listed on there.
And 9net.org/health.
And Mo Health Report.
You got it. Okay, go ahead. So I'm sorry, I cut off your train of thought there. I apologize.
Okay, and then there's certified application counselors, which they do the same thing, but they're funded through grants or private organizations. So they do all the same thing, it's just kind of different titles. And then there's also another one that's in-person assisters. Same thing though.
Okay, back to the reporter's notepad. What else stood out tonight?
Oh, okay. So also another thing that's really important is people are upset that they aren't getting a lot of information about this yet. Well, something that's really important is big campaigns, state campaigns, Illinois' campaign, Missouri Foundation for Health's private organization campaign. They're holding off on their mass media launch at the moment because if the website isn't working, why would they try to direct people to it? They are focusing, they're still campaigning, they're focusing their attention on education and awareness. So they're just trying to reach out to people, having meetings, being active on social media, and Get Covered Illinois is about to launch an educational campaign.
So once they get the kinks worked out, as a lot of people here tonight believe they will on the website, we're going to see more of a flood of information on a traditional campaign, you think?
Oh yes, you're going to see print ads in newspapers, digital ads online, Facebook ads. You'll see pre-roll ads before YouTube videos, the little 15-second advertisements, radio ads, so television ads too, obviously.
Talk about, let's go back just a couple of conversations when we started to hear about how recently in the news the urgent care that closed here locally and the predictions we heard from the table that's going to continue to happen throughout the state. Are you seeing any of that in your reporting, any of the effects of that gap that we're talking about, of the not having Medicaid expanded in Missouri?
Oh, definitely. These centers that rely on grants are suffering, and hospitals that aren't getting pay from the government anymore. It was when they formed the Affordable Care Act, the idea was that states were going to expand Medicaid, and so that would take up the coverage for these people that couldn't afford it. And so the federal government stopped this pool of money that it would pay back to the hospitals. So now the hospitals aren't getting anything. So they're really suffering.
Are we suffering because of that? Is that going to have an impact on those who don't depend on those resources?
I mean, if you work there, yeah, for one thing, it's loss of jobs, and then also it could have an impact on hospitals getting into insurance networks too. I mean, there's a lot going on, and a lot of it does have to do with the Medicaid expansion. But then you see this positive stuff going on, how you have pharmacists and other people that are going into the primary care now. You've got nurse practitioners are taking it on more. like Chinooks, for example, they just opened an infusion therapy center. So, and like they said, it's health reform that pharmacists are becoming more following up with the patient, because for cost control, they're wanting to keep people out of hospitals more.
Final thought, we have just a little bit of time. Anything else on your notepad that you want to make sure we get right tonight?
Okay, this is kind of funny but interesting, I think. Everyone gets really upset over this, and they say that Obamacare is dead, that it's ruined now because of the glitches. Well, it's also really important to remember that Medicare had a really messy rollout too. It was depending on people being able to come in and prove their age, and most people at that time didn't have birth certificates. One guy had to bring in his mother's tombstone to show when his mom was born and died, and insisted that that proved that he was old enough.
That I do not believe will fit in a fax machine.
No.
Fax machines are old too. Okay, sorry. Okay, anything else? We have just about 10 seconds. Anything else you want to say there?
Nope, I think that's all.
Okay, good. Then the rest of the questions I have written down for you, we will have to handle in the post show. I think one thing that you brought up that's fascinating is the passion for politics doesn't translate to the passion for healthcare.
It doesn't.
All right, well, let's talk about that online at the post show. For now, for Ed, Reggie, and for all the guests tonight, thanks for watching and stay tuned.
Nine's health coverage is supported in part by the Missouri Foundation for Health.
Okay, thanks for sticking with us. We've got a few loose ends to tie up here. I feel like we started a few conversations that didn't get finished. Before we do that, let's check in with Ed. What was kind of the theme tonight, if there was one, more than one?
You know, a lot of people are saying they're learning things that they did not know, which is, I'm not trying to say that
No,
to
check. That's
check
good.
that off the list there.
That's good.
But,
That's good.
you know, these are for sure some comments, I think, themes. A lot of people saying economic issue, social justice issue, health insurance affects everybody. And then I'm going to follow that up. One person, Chelsea, said, too rich for Medicaid, too poor for Marketplace. Some of the themes in there, you know, people are feeling that push and pull.
You resonate, does that resonate with you there? We barely touched on your story.
It absolutely does. I cannot express the stress of not being able to access health care. And that is amplified when there are people sitting in Jefferson City who are elected to serve the people of this state, and they refuse, because of their political party line, to offer people health care that can save their lives. There is not a word to describe what that feels like and the stress that it adds to an already stressed body and mind.
We were talking before too. The ACA, really when it was constructed, I don't think they ever thought that there would be pieces that would be taken out. Right. It wasn't designed with redundancy or flexibility. It counted on each piece being there in different spots. And so when you had a Supreme Court ruling that said, oh, this piece is optional, there's holes in the law now where it's just not consistent. And yeah, there are groups that if you're sitting right in the middle there, you get left out.
No, sorry, I didn't mean to interrupt you. But I think that even with the Supreme Court decision, I think there wasn't a thought that states would turn down basically free money. I think there was this idea that it's such a no-brainer that they would take the money, or maybe a few states. It wouldn't be 24 states. I think the idea that there's just this huge gap between some states and other states in the United States is astonishing, to me at least, and I'm sure to a lot of other people. Jen, I know,
and I just have to interject
to
say, of course, I've talked to a lot of people who point out that that's not free money. I don't know the exact percentage of what Missouri sends to Washington versus what we get back, but nevertheless, those are tax dollars nonetheless that come from the states.
But now those tax dollars are going to another state. That's the important thing. We would get $1.5 to $2 billion if we expanded Medicaid, and since we aren't expanding Medicaid, it's going to California and Wisconsin and Minnesota. So those are dollars we're just turning turning away.
Are we just turning away? Are we losing some others as well? In terms of when you look at the big picture and the resources?
It's even worse than that, as Rob, I'm sure, can speak to, because, you know, there are cuts in the bill that were there, you know, as was pointed out. It was never anticipated this would happen, so there are cuts to disproportionate share payments, there's cuts to hospitals, there's cuts to Medicare providers that are still going to go into effect, but yet we're not getting that $1.52 billion to counteract that.
Always.
And so the hospitals and safety net providers are going to take those hits, but they're not going to get the dollars, which were supposed to counteract those effects. So we're kind of definitely within a rock and a hard place at the system level as well as at the person level.
And we end up with even fewer safety net providers for people.
Say that again, the boom was over there. Sorry.
And then we end up with even fewer safety net providers for people who are uninsured. You know, as a community and as a state, the decisions that we make reflect our priorities. And as everyone has said, health insurance is critical. It does save people's lives. And we have to remember, to me, you know, at the end of the day, this is about people's well-being and about their lives. And that means if people can get access to plans through the marketplace, we need to get them the information they can, encourage people to be patient, try again, and we've got to pass Medicaid expansion for the people in this state who are relying on it.
I remember when those people don't have Medicare expansion, you know, those costs come back to haunt us later on, right? They'll at one point end up in the emergency department with nobody able to pay for their care. They'll go to places like BJC and they'll have the complications of diseases that would cost very little to treat now, but we're going to cost a whole lot in the long run. Or if they have really untreated hypertension that may cost pennies today, and that develops into a stroke down the line, that may be a $20,000, $50,000 hospitalization. And these are catastrophic costs that really build up.
You're acting as if the stroke doesn't get treated. If somebody has a stroke and they end up in the hospital treats them and stabilizes them. So those costs are already built into the system right
And they're
now.
shifted to us who have insurance, and that's
And
the
that's
point
exactly
that's
right.
making. And so the point is, we're already paying for this. You know, the
But-
estimates are $500 for a person or $1,000 for a family. So to Casey's point, you know, we're already paying for this. So
it's
why
already
not? Why not redistribute it better?
It's
So-
already built. The costs are already built into the system. We're already paying for it through increased insurance premiums. All we've done is added several middlemen, and we have multiplied the cost by a factor of 4 or 5.
I'm not sure I agree with that, but
Well,
I think
let me tell you just exactly, because the young gentleman who they did the piece on there was talking about the $94 that he was going to have to pay after the subsidy. He could buy a policy today for $60.
Would it cover what's going to be in the new insurance plan? I don't think so.
Yeah, that is not true. You do not know what those plans cover. And if he bought that plan today, he would have better coverage than he's going to have in 2014.
He would. You mentioned he. That's one important thing I want to point out. It's a male. But what about a female? What about somebody who's 50 years old and has an illness? And that's part of what this bill is part of. To spread those costs around other people.
Right now, I'm here right now with a condition, with a diagnosis that, thank God, I have not had a recurrence of cancer yet. But because I have Gateway to Better Health, I can have those tests. I can't afford to get into an exchange. So what we're really talking about is Missouri gonna sit by and watch its citizens be sick and dying? That is what will happen. If I do not know that this cancer comes back in my body again, if I don't have a way to know that is happening, I will die. That's the bottom line.
And why did you lose your insurance in the first place?
My employer could no longer afford to pay for it.
Right.
And I could not afford to pay for it.
It was expensive before. It's twice as much. One of my clients,
spread over more people.
What my salary would have been, if I were at full salary, what it would have been, and what I would have been able to pay on my full salary. I would have been able to do that. So it wouldn't have been more. It would not have been more. It would have been a benefit to me, and it would have been less than what I was paying with my Cadillac insurance when I was first diagnosed.
I think there's also an underlying conversation that we don't have around Medicaid is there's a stigma against the people, whoever we think those people are, who are on Medicaid. The reconception now is that Medicaid is going to be for a whole host of different people who are transitioning, people who need long-term insurance, and that is going to be, should be available for people in Missouri who need it, and that's the underlying conversation. It's not the economics, or it's not the, is Medicaid good or bad? It's, there are people who need this, and there are going to be all different types of people, so we shouldn't stigmatize them and we shouldn't pigeonhole them. We should say these are people who are citizens with us, and they need something, and they are hardworking people who pay taxes as well, and they should get a benefit from that.
Nobody is trying to deny them benefit. All we're saying is there are better ways to price the plans or the coverage for them. You could,
but I think
you
that
could
addresses the private insurance issue, not the Medicaid issue.
No,
Medicaid's
it
an independent issue.
addresses. There are 800,000 people in this state who do not have coverage. If you tax every individual's health insurance policy, which we have a precedent for and has been successful with the pool, if you taxed every individual's policy $110, it would still be less than the ACA plans, and everybody, those 800,000 people would have free coverage. Free. And we wouldn't have to go through this mess that we're going through right now.
Is that something people are talking about doing? Is that one of the options the Republicans are talking about?
It's not, but nobody, everyone.
So why not?
I feel sorry because everyone has. Everyone has a horse in this race, and they want to protect their little area.
We've been waiting 100 years for an option to provide universal coverage, and in the United States, people who are uninsured.
The United States has not been waiting 100 years for that.
We started with Teddy Roosevelt in 1915 when he was the first to talk about universal coverage, and it wasn't passed until now, 2013 or so.
The most successful healthcare delivery systems in this city are SSM and Christian hospitals. Both
for
of
those
them
who
were,
have coverage.
No, both of those were set up for free. It was the sisters who set up SSM. They did it to take care of smallpox victims after the Civil War. The Christians were set up by a women's auxiliary.
So the answer you're saying is charity
A women's
care.
auxiliary
So people need to get charity care.
who raised the funds, had land donated so that they could serve the poor. And those systems were very successful. Now, why can't we use those as an example?
So we want to have a perpetuation of
as an example.
I think you have to put it within a context, because what we're talking about is a historical context of 100 years versus now, where costs for healthcare has just astronomically gone through the roof. Yeah. So some of the conversations that we're having aren't germane to what we're talking about today. Of course, what you're saying, with me being a pastor, I can sympathize with that. However, the issue is that if we were to do that today, I could barely get a flu shot. And it will not suffice for what I need to have long-term as far as healthcare is concerned. I think that, though, there has to be somewhere in the middle, some type of balance, because honestly speaking, the Affordable Health Care Act does have some issues that really need to be addressed. The unfortunate reality is we've made it a political football rather than a human issue that needs to be addressed. And if we were to remove the layers as far as, well, this is President Obama, because I guarantee if George Bush had done this, or even if Bill Clinton had done this would be a mute issue. We wouldn't even be having this discussion. That would be taken care of from a legal perspective and from a tax bill perspective. But since it's Obama, and since I'm here and I am who I am, the issue is race. And the issue is political. Yes, it is. Oh, no, don't please. No, because we can't. Because we can't.
Which part are you talking about? Are you
talking
about Obama? Are you talking about Obama's mother?
There you go. Obamacare is affordable.
Are you talking about
the proper name is
Obama's father?
The proper name is affordable health care.
Which
the proper name is affordable health care.
There's a good. Let me help you with this.
The proper name is
I walked into a conversation.
Yeah.
I walked into a conversation with a Missouri state senator. His words were, "We cannot continue to give people things for free because they don't know how to build character. And without building character, they'll never work." And I had to say to him, "Excuse me, but I get up and go to work every day, 10, 12 hours a day sometimes. I don't know who you are referring to, but I am not one of those people. And you not expanding Medicaid means that you will effectively kill me. The people he was referring to are black people in Kansas City and Missouri, who he will let people he represents in rural Missouri be sick and dying because he does not want black people to receive health care. That is insane. It is inhumane. No one in this state, black, white, red, yellow, whoever, should have to live in fear of not being able to go to a doctor or have medical treatment because legislators sit in those state seats and won't expand Medicaid. That's the central piece that's missing, the humanity of the people sitting in the state legislature. People in this state will be sick and dying if Medicaid is not expanded.
And the perception is it has to be done in an economically viable manner.
And it has. It's paid for.
Otherwise,
It's
otherwise
balanced,
it will
so.
hurt the people most who need the care the most.
I don't believe that.
Is there something that can be done?
Is there obviously go to you are not hurt the most? Trust me, I have lived this for 3 years.
So
Why
one of
can't
the
we-
points that needs to be made about this is this bill, the Obamacare bill, Affordable Care Act, whatever you want to call it, is a Republican bill. Everything in it is come from Republican ideas. The individual mandate was a Heritage Foundation's idea. The exchanges came from the Heritage Foundation. This is not a liberal think tank. So where the Affordable Care Act came from was when Clinton plan failed. They said, well, okay, let's start where we ended, where the debate was close to being passed, when the Republicans, Bob Dole and our senator from Missouri, were almost close to finding a compromise. And they said, we'll start with that bill, which is a Republican bill.
So if it was
so we've
Republican,
passed
then
the
why didn't
Republican.
Nancy Pelosi read it?
She read it. Oh, come on. Her staff read it. I've read it.
Let me just
Have you read it?
interject.
So-
Let me just interject this: that we're about to run out of time. So let's. Ed, you started to jump in with a tweet. Did you want to say something that was coming on online?
I just wanted to say that it affects. I want to go back to that. I mean, 'cause people are echoing that what I said before. It affects everybody. I mean,
Not just those looking for
it absolutely class issue. It's a race issue. I mean, it's not just one thing.
Jen, I cut you off. I'll give you the last word.
All right. I think, we have a history as a country when we pass things. Nothing's ever perfect the first time. We work to make it better. Nobody I know would say that the Affordable Care Act is a perfect piece of legislation. But what we've seen is playing politics with it rather than saying, let's implement it to the best of our ability. Let's get people health insurance through the marketplace, through Medicaid expansion. And then as a country and as a community, we look and we make it better. Rather than saying, it's not perfect, so we're not going to sign people up for it now. We're going to let them be sick. We're going to let them die. The solution is get people enrolled now, get them covered under Medicaid, and then we can keep talking about how to make it better.
And we're going to keep talking about this on Twitter. And don't forget 9net.org/health for information about how to navigate what we've currently got. Thanks, guys. I appreciate it. Good job, everybody.